has its ups and downs. Turn your pretty face to an ugly frown. Seems that when I fix one thing.
Hello, welcome to The Awakening. I'm your host, Angela Brown. Today's topic for discussion are tummy tucks. I've received many calls and emails to please have someone on with tummy tucks. And I have Dr. Nia Banks, and she's here with me today, and she's a plastic surgeon, and we're going to be talking about tummy tucks. Nia.
Pleasure to be here.
Thank you. What is a tummy tuck?
Well, a tummy tuck is a surgical procedure, and the design of the tummy tuck is to get rid of excess skin in the lower abdomen, as well as excess fat in the lower abdomen, and to tighten the abdominal wall muscles.
So when you have a tummy tuck, are you cut from side to side, hip bone to hip bone, right?
Pretty much, yes.
Okay. And then in order to tighten the muscles, you have to go up inside.
Correct.
Ooh.
Correct. Now that sounds like a lot.
Is it like, I've seen so many, autopsies. Do you do like that?
Not quite like that. There's no vertical incision on most tummy tucks. The incision is transverse across the lower hip, so it should be hidden in your underwear or in your bathing suit. Mm-hmm. But the reason for that is that we have to remove all the excess skin in the lower abdomen for some women. And for most women who've had a couple of children, they find that even though they work out, even though they've lost all the baby weight, they still can't get a tight tummy like they used to. Mm-hmm. And some of that is skin, especially if they've had stretch marks. Mm-hmm. But some of that is that the abdominal wall has been stretched out. And no matter how much you work out, sometimes that doesn't tighten. So the big benefit of a full tummy tuck is to be able to get to that abdominal wall to do a nice tightening, like a corset mm-hmm. on the inside.
Well, I would think after having children, you'd be pretty loose under there anyway.
That can be, absolutely. It's a big problem.
So if you're cut from hip bone to hip bone, then you lift up, excuse me. When the doctor goes in to do the procedure, how do you tighten the muscles?
Well, we do that with sutures. We use strong, usually permanent sutures to tighten the fascia. We plicate it just like we're cinching a belt with the suture, and all the sutures get left behind to hold that fascia in place permanently. So it's like, as I said, wearing a corset on the inside.
I'd be darned. So I guess if you have a hiatal hernia or something like that, when that's done, can that be corrected along with that?
It's a little bit different. The hiatal hernia oftentimes now are repaired with laparoscopic surgery. So this wouldn't be done in conjunction. Usually it's not an open surgery. But if you are having an open abdominal surgery, unless you have some major wound healing problems that they're worried about, generally we'll do it separately. We do it sometimes with pelvic surgeries like hysterectomies or surgeries for polyps or fibroids, but not often with other large abdominal procedures.
Well, let's go back a little bit. What made you want to be a doctor to begin with?
I wanted to be able to help people directly. I like working with people. I wanted to be able to help all ages of people, children and adults, and I had a love for the sciences, so it's a good combination.
Now, do you do other procedures other than tummy tucks? I'll get back to them in a minute.
I sure do.
What else do you do? Facelifts?
We do facelifts,
okay.
Yeah. We do all types of facial reconstruction. Actually, my fellowship training is in craniofacial surgery.
Really?
So that's my particular area of interest.
Okay.
We do facelifts.
Why is that your particular one?
I love the anatomy and the head and neck.
Really?
Yeah, the anatomy there is very compact and of course very essential, and the face is our calling card. It's where we make our largest impact in plastic surgery.
That is true. Yeah. How long have you been a plastic surgeon?
This is my first year in private practice.
Oh.
Yes, I'm very excited to be in the area. Before that, I completed a 6-year residency at Johns Hopkins up in Baltimore.
Good hospital.
Very good place. And after that, I did 1-year fellowship in France.
I've lived in France for a while.
Let
me ask you this, Doctor. Doctor, if I was to come into your office, where would you do my surgery?
Depends on what you're having done. If you're having reconstructive surgery, we have privileges at Johns Hopkins, Doctors Community Hospital, and Prince George's Community Hospital. If you are having cosmetic surgery, that's generally done at Dimension Surgery Center right here in Bowie.
I didn't know they had that.
Absolutely. Dimension Surgery Center, which is right here across from Bowie Town Center, is where we do most of our cosmetic procedures.
Is those all the new buildings that just went up across from Bowie Town Center? Oh, I didn't even know that was in there.
It's the Bowie Health Campus.
Bowie Health Campus. Say that again because people are going to want to hear about that.
Yep. We do most of our cosmetic procedures at the Dimension Surgery Center, which is on the Bowie Health Campus.
Oh, that's wonderful. So you do more of the tummy tucks than the other procedures, do you think?
It is.
Really?
I would
Why do
say-
women want to do something that's covered up all the time except when they go to bed?
Because you can still tell the difference in your clothes. You can tell a difference in your clothes. So this is trade-off for, we're trading contour for scar, which is a lot of what we do in reconstructive and cosmetic surgery. We are improving the contour of your abdominal wall. You're going to lose a couple of waist sizes. Your pants are going to fit better. You'll be able to tuck your shirts in again. You'll be able to wear that bathing suit on the beach and not be worried about your muffin top or your mommy belly. So it's a very popular procedure. It's probably the most common cosmetic procedure that we do. The majority of our practice really is reconstruction, but for cosmetic procedures, that is the most common thing that we do.
The most common thing.
It is, because a woman, once she's had a child, things are usually a little stretched out. It's very
Right.
difficult to get that body back.
I know my sister was diagnosed with a couple of hernias, but she'd also had 6 children.
Yes.
So have you heard of Dr. Jack Frost? He's
No, I have
out
not.
towards Annapolis.
Okay.
She heard about him, so anyway, she went in, and because she had the hernias, the doctor
Yes.
said, I'm going to throw in a tummy tuck for free because you
You're
know,
already having the
you're already being, cut from
Absolutely.
hip bone to hip bone. But I
Absolutely.
can tell you she was in a lot of pain because she came to stay with me.
Right.
And she had a 2-year-old, so my niece was there with me as well. But she
Right.
was in a lot of pain. She said
Yeah.
she felt very tight,
Yes.
which was good. But she said it was very hard to walk
Yes.
and straighten up.
Yes.
Okay.
That is true.
We're not trying to frighten you, ladies, believe me, but I want you to
Yes.
know the pros and cons.
I would just have to say that there is some pain with a tummy tuck because we are tightening the fascia of your abdominal wall and the skin incision, and things are tight. But I would have to say that probably the majority of that pain came from the hernia repairs themselves.
Yeah.
Because whenever you go through the fascia or through the abdominal wall musculature, that's very painful. So that combination of surgery, it's possible, but usually when women come to me, they're just getting the tummy tuck. They're
Okay.
not getting the tummy tuck plus something else.
Okay, but they're still
Yeah.
getting the tightening of the muscles.
Still getting the tightening of the muscles.
And they know that.
They know that, absolutely.
I'm sure you explain everything to the women.
We try to explain very well.
Right.
And we try to explain also with pictures, and we have plenty of informational brochures in the office as well.
What about just a partial tummy tuck? Where do you cut the woman then?
There's a procedure called a mini tummy tuck or mini abdominoplasty, which is an incision that goes at a similar level, low across the hips. The length of the incision depends on how much skin you have to remove. In general, we say that the incision needs to go from one end of the defect to the other. So if you have loose
one end of the
skin,
what?
one end of the defect to the other.
Okay.
So if you have skin that is loose, that's from hip to hip, then that's how
Right.
long the incision will be. If you have skin that's loose, that's only right below your tummy, right below your belly button, and it's only a few inches long, that's how long your incision will be.
'Cause my
So it really
sister's-
depends on you.
Because my sister would say she would sit down and on her sides, she could see a little
Yes.
bit come down on her leg.
Right. Okay.
So-
So that part that's coming down on her leg, we would have to bring the incision at least to there, at least to there.
Right. Okay, let's talk about tummy tucks. Other than tummy tucks, let's go talk about our eyes.
Okay.
When is a good time for a woman to have her eyes done? She's got big, huge bags. I'm thinking about putting some fat onto my own eyes, but I don't want my eyes done.
Well, the eye surgery depends very much on the age. For women who are in their 30s and their 40s, some of the first thing that we see is a little bit of extra skin on the upper eyelid. Sometimes a little bit of bags underneath the eyes. And sometimes that can be camouflaged on the lower lids with injectables, which are temporary, but can help fill in the gap between the bag and your cheekbone.
What do you use as a filler?
All types of things depending on how long the woman wants the effect to last.
So you can choose.
We have fillers that last from as short as 3 months to as long as 9 months to 1 year, depending on what your need is.
What is that, Restylane?
Yeah, the shortest acting one is Prevail Silk that goes away in about 3 months.
Never heard of that one.
That one's just like Restylane and Juvederm are the same thing almost, made by different companies. Prevail Silk is made by a different company, same formulation except it doesn't last as long. So the cross-link is a little
all
bit
of that
different.
stuff safe though, Dr. Banks?
It's all safe. It's all hyaluronic acid, which is something that's already in your body.
Some of it's already in our
It's already in your
bodies.
body. It's the majority of your tissue underneath your skin is made of
Okay.
this.
Do you do brow and forehead lifts?
We do.
How do you do that?
Well, the brow lift is usually done in a temporal area. If you have loose, just want to raise your eyebrow, that's usually an incision that's made just below the hairline at the temple. A forehead lift means the entire forehead. That's usually an incision that's made behind the hairline.